the Queensland government has initiated an independent review into the provision of gender-affirming hormones following reports that these treatments were administered to children as young as 12 years old without appropriate consultations and authorizations. This pause in treatment underscores growing concerns surrounding the delivery of gender-affirming care to minors, a matter currently under intense global scrutiny. The controversy stems from a lack of clarity regarding the ethical and clinical implications of providing such treatments to children who may not possess the developmental maturity to fully grasp the long-term consequences. The Queensland government's review aims to ensure that future practices adhere to stringent ethical guidelines and robust clinical protocols, prioritizing the best interests of the child throughout the entire process. The decision to launch this review is not without precedent. Internationally, the debate surrounding appropriate age for commencing gender-affirming care has intensified significantly, particularly following the publication of the Cass Review in the United Kingdom. This highly controversial review ultimately led to the National Health Service, NHS, implementing more restrictive guidelines concerning the prescription of puberty blockers for children. The Cass Review highlighted the need for a more cautious approach, emphasizing the importance of extensive psychological evaluations and a thorough understanding of the child's developmental stage before commencing any irreversible medical interventions. The review emphasized the potential for regret among patients who underwent gender-affirming treatments at a young age, underscoring the critical need for comprehensive assessment and ongoing monitoring. The Queensland government's actions reflect a growing international movement towards a more cautious and comprehensive approach to gender-affirming care for minors, prioritizing thorough evaluation and informed consent as paramount considerations before initiating hormone therapy. The independent review is expected to delve deeply into the existing protocols, clinical practices, and decision-making processes within the Queensland healthcare system to ensure that any future treatment plans are fully compliant with best practice standards. The outcome of this investigation will have significant implications not only for Queensland, but potentially for other jurisdictions grappling with similar ethical and clinical challenges.